Let's talk about that popping sensation or pain that you get when you try to do leg lifts. You know, when you're on your back doing dead bugs or leg lifts or even hanging knee raises, anytime you're doing hip flexion and you get that pop. Now, one of the most common causes of that popping sensation is the psoas tendon rubbing over that iliopectineal bursa sac. So you get this rubbing. And now one of the things that I find causes the rubbing, because you're like, well, the psoas is supposed to work to lift the hip, so why the heck is it rubbing? And one of the reasons that it rubs is because we end up going into femur external rotation and internal rotation as we lift. At least that's what I found to be the most prominent cause as I'm working with people. So as you lift your leg, instead of keeping a nice straight track, it ends up rotating in and out. So what that will look like is someone will lift and they might start a little bit out and then they turn a little in and then they go a little bit out again, and then that creates this rubbing. And it can be really subtle, but if you videotape it and watch the femur, you will often see this rotation component. So one of the tricks that I really like to use for this to eliminate that rotation is to pick a direction and stick with it. I usually like to do a pinch of external rotation because the psoas does external rotation. And frankly, when we're doing leg lifts, I tend to want to bias somebody's psoas over their TFL. Your TFL does internal rotation. So if you rotate in, you're gonna get a little bit more TFL for the leg lift. If you rotate out, you're gonna get a little bit more psoas. Psoas also likes to work in a lot of flexion. So it's good for things like this. That psoas is really gonna kick in. So if you will bias out just a pinch, tighten your lower abs to give yourself that really stable base from your pelvis to move from, then you can do leg lifts, and that's going to decrease that rubbing or that popping sensation that you're getting. The reason you really want to tighten your abs for this is because you can either let your femur rotate in and out, or what can happen is your femur could stay straight, but your pelvis could rotate in and out. So let's say I'm going to go lift now and I let my whole pelvis shift. Well, that created the rotation from the top down instead of the bottom up. So either way, you're still causing that tendon to rub over that bursa sac, still getting that pinching, that's one of those causes, and holding your pelvis stable and then picking a rotation degree for that femur and keeping it there through that hip flexion can really help to minimize or eliminate that irritation and that popping noise.